how much longer is this going to last? We've gotten answers before and then they changed. I'm getting sick of this. Sound familiar? I'm hearing it more and more and more. And I think it falls under the category of what we've been calling pandemic fatigue. Interestingly, we were talking about this already in May. We did a little stint with Marty Guthmiller in August, talked about this pandemic fatigue, this ongoing accumulation of frustration, and it continues. So we thought that we would try and develop some strategies to manage it. And a part of those strategies is learning what's behind some of the fatigue. And one of those concepts is when something difficult happens, we often develop this sense of heroic spirit. We put ourselves into something, we try to make it work, and it goes for a while. But when it goes on and on and on, then sometimes we stop our heroic spirit and this phase of disillusionment happens. And then sometimes we don't make such good choices or don't try as hard. Again, that's the thing that we want to begin to try and manage. A part of the reason for that is that when we make change, any type of change, even change that we consider to be positive, it takes more emotional energy. It takes that energy to be intentional and to sustain the intention. And it needs to last for a while. Unfortunately, a while back, starting in the 60s, this saying got put out that if you do something 21 days, it becomes a habit. No science behind it. It was developed by a cosmetic surgeon who just decided to tell his patients that. When they've actually tried to study it, it just doesn't happen. We don't know how long it takes to put something in place and for it to become automated. So we just need to keep doing it until it does. We just don't know how long that's going to be, which is one of those statements we need to be aware of. And that is, as we go forward, we need to be doing things not because it feels good, but because we know that it will be healthy, it will be right, it will allow us to become stronger. If we only do what we feel, we're more prone to make poor choices. Another component that I think is important is to begin to talk about the importance of self-care. We mention it. I have lots of discussions in my office with young families and young parents about that, but it's important to emphasize it now, not because when we talk about self-care that it's being selfish or self-absorbed. It's being able to take good enough care of ourselves so that we can continue to care for others. So one of the ways of doing that is what we've talked about before. We had this discussion back in August using the acronym OCAHS. But instead of Orange City Area Health System, we're going to talk about observation, choices and connection, adaptation, health, and then showing others how to do that self-care. Cognitive behavioral therapists will tell us that the emotions that we experience are not from other people, even though we hear statements like, well, he made me so mad, or she made me so sad. They're not even based on our circumstances. The emotions that we experience are based on what we tell ourselves, our thoughts. And many times our thoughts are based on what we're looking for, what we observe. We have to be very careful about what we observe. One of the things that we want to be observing during this time are things that we can control. Again, it's sort of crisis management 101. If we focus on things we can't control, we often feel unable to influence, powerless. But if we focus on the things that we can control, things that can allow us to feel like it makes a difference, many times having to do with ourselves rather than other people, we can begin to feel empowered. Also, what we choose to look for within situations makes a big difference. It's easy to actually look at the negative, but can we begin to see positives coming from things? Can we begin to find appreciation and gratitude in situations rather than just looking at the negatives? That becomes a little bit more work, but it's very powerful. Going to the control or the connection, the choices that we make. Again, when we make choices, we need to make sure that we're connecting. Some people choose to disconnect, and usually those outcomes are unhealthy, physically and emotionally. Most of us choose to connect, but we also have to be aware of what we choose to connect to. Probably not coincidence that during this pandemic time, alcohol use has gone up 14% or more. In 2020, September of 2020, internet gambling was up 100% as compared to internet gambling in September of 2019. And even recently, chocolate consumption has increased about 6%. These are pretty common examples of how we choose to find something that gives us enjoyment and pleasure, but we have to be careful that it doesn't create long-term difficulties. We want to be connecting to things that provide us empowerment and encouragement, things that will allow us to sustain ourselves. Those tend to be things like our friends, our family, our faith, things that we can begin to use not only during this time of crisis, but continue to use thereafter. A is adaptation. Again, psychologists will tell us it's important during a time of stress, a time of discomfort, to have structure, to have some routines, to have some sequences that allow us to feel like there is some consistency in our lives. And that is important. However, we have to be careful, because if we become too rigid, if we have those expectations become expectations that are unrealistic, and we hold on to them and we're not flexible, that can also create a great deal of emotional distress. So we want to be thinking of, there is a new norm. Things are not necessarily going to go back to, quote, normal, end quote. We have to begin to see that things will be different. Change is necessary, and it can be healthy for us. So we have to be adaptable, even though we don't always know what the outcome is going to be. Next is health. Again, there's lots of really good sources out there to make healthy choices. Some that I want to make sure we emphasize for health has to do with correlates of physical and emotional health. One of the strongest correlates for physical and emotional health, exercise. Exercise is shown again in studies time and time again to be able to allow people to be healthier, to have a sense of well-being. So you want to think big. Think of 3 to 5 times a week, 30 to 45 minutes. And if you do that, then you begin to produce endorphins. They will let you feel better. However, if that's not something that you're used to, then just start somewhere. Just see it as an activation process. Take a 5-minute walk, get on an elliptical, get on a treadmill, just activate rather than becoming passive or sedentary. Exercise makes a huge difference, but also just taking care of your body, getting enough rest. Resting and restoring your brain and your body is essential. When we don't, and when we experience sleep deprivation, it's like a giant press on everything else. So make sure that you're getting adequate rest. But also eating well. Again, eating well means feeding the engine, filling the tank, not overfilling the tank, but filling the tank so that you can sustain what you need to do. And then again, a lot of the other health suggestions. Wear a mask. Be sure that you're washing your hands frequently. Maintaining adequate social distance, but also maintaining social connection. Those are all going to be healthy choices that we can intentionally attempt. And then lastly, the showing others, and again, showing others self-care. We're not doing this to be selfish. We're actually providing a gift for those that are watching, and we are being watched, which allows us to then show others how to manage stress. Do those kinds of things that we're doing, again, not because we're self-absorbed, but because we're trying to be there for when others need us so that we can continue to be there physically and emotionally for them. We are in this in the long haul, and if we don't take care of ourselves, we will quickly become exhausted and frustrated. So, as we move forward, the answers are going to change. They've already been changing. And we don't know all the answers. There looks to be some real positive things on the horizon. But we also know that the answers may change, things may be different. We don't know the answers. However, we do have the skills to continue to manage this. Stay healthy.